Hi everyone, welcome back to my channel. My name is Matthew Faisa and I'm a third year medical student from London. In this video, we're going to discuss probably the most reported problem or cause from a patient going into a general practice centre in primary care, and that is lower back pain. We're going to look into how it occurs and how to relieve it or prevent it as a whole. This video is part of a bigger 3-part series where I'm going to look into the mild, intermediate and serious causes of lower back pain. This is part 1 of the series. So I'm going to look into the mild conditions which may irritate or instigate lower back pain. Firstly, let's discuss what we consider lower back pain to be. Lower back pain, also called lumbago, is not really a condition, it's more of a symptom as a result of further weakness in the body. It usually results from an issue with different sections of the back and the muscles involved. So it could be a ligament issue, it could be a muscle issue, and in more serious cases, it could be a bone issue. One of the most common causes of mild lower back pain is muscle sprains and muscle spasms. Even though these issues can cause sometimes quite serious pain in relation to the potential issues of bones and nerves being impinged, it is milder in that sense. Sprains and strains account for a large majority of acute back presentations by patients. Sprains are caused by the overstretching of ligaments, whereas strains are caused by slight muscle tears. Both of these can occur through lifting something too heavy with incorrect form or excess twisting of the back. These movements can also elicit muscle spasms in the lower back, and that is the result of an overactivation of muscles in that region. One of the most common causes of general back pain is also incorrect posture, such as sitting slouched and not with your shoulders rolled back. In addition to that, lower back pain can also be the result of a lack of exercise and mobility, such as in this current day, a lot of people are living sedentary lifestyles where they're sitting down maybe for their work or just when they're at home. Just by increasing your exercise, you can strengthen the muscles in that region, and as a result, that kind of detracts away from the pain caused, as you have greater stability muscles when you're standing up and sitting down. In terms of the actual presentation of lower back pain, acute lower back pain can feel like a constant dull pain in the back, which transforms into a sharp pain when you twist or kind of change direction suddenly. As a result, to prevent that sharp pain, when you have lower back pain, typically you're going to have little mobility and you're going to feel quite stiff. This form of lower back pain tends to only last a few weeks, so let's say maybe about 6 to 8 weeks, and tends to go away on its own. One of the muscles you can strengthen in that region is the glute muscles. The glute muscles kind of take the pressure off your lower back. In addition to that, you can also strengthen your core, so your abs, and doing core compound movements in the gym, such as maybe the bench press or the deadlift. These strengthen your core and as a result detract from the lower back pain as they take pressure off. In terms of treatment, there's something referred to as the WHO scale for pain, WHO. I'll put that up in the corner. And it basically goes through the steps of pain medication you should be taking. So typically with lower back pain, if you really want to take medication, you should really stick to that upper category, which involves the use of paracetamol or ibuprofen. These can kind of temporarily take away from the back pain. However, in terms of inducing a long-term fix for that lower back pain, exercise is the number one thing you can do. This concept is referred to as exercise prescription, where you use different forms of exercise to strengthen your body and detract away from the pain, rather than taking the kind of the quick fix and temporary fix of using. Everyone in their lives is going to experience some form of lower back pain. Even if you are the most active person, eventually you're going to have it, whether you're from a child's age or all the way up to as you get older. There are some risk factors which make you more susceptible to having repeated lower back pain. These involve, as we previously said, not doing exercise regularly, having a sedentary lifestyle, so sitting down a lot, engaging in high impact activity without stretching properly, getting older, smoking and obesity. In addition to that, you could have some forms of osteoarthritis. However, I'm going to speak more about that in the intermediate section of the video. At the uppermost limit of mild lower back pain, you may receive steroid injections. These would only really be used if your back is red hot and really visibly inflamed. The steroid injections act to reduce this inflammation and help relieve some of the pain and the stress on your lower back. Typically, if you have got inflammation but do not want to receive the injection, you can use other temporary forms, whether that's in the form of gels or sprays such as deep heat or a hot water pack. These again are only going to really give you temporary relief. So as I've been stressing in this video, exercise is the #1 form of treatment for this condition. Even though it does seem quite counterintuitive in the sense that you have pain and I'm telling you to work out more. But the idea of exercise prescription, as I previously said, is you want to strengthen the other muscles in that region, which helps take the load off the back. So it is going to feel quite uncomfortable. Don't push yourself necessarily when you have lower back pain, but just keep yourself active, and over time that pain is going to be significantly reduced and it will less likely happen again. However, I want to stress, if you are still feeling pain despite the use of exercise, despite the use of medication and these temporary forms of pain recovery, pain relief, then please go to the GP. But you may ask, Matthew, how am I supposed to know whether my back pain is mild or more serious? Well, here are a few red flags that you may want to consider, and if you experience these, perhaps go to the GP or A&E. The first red flag would be if the pain keeps getting worse and worse. Typically mild lower back pain as a result of sprains or strains are quite constant and dull. So if you're having a constant feeling of sharpness or whether it radiates to different parts of your legs, then please go to the GP. In addition to that, whether you've been hit by different objects or have had some trauma to your lower back, then please go, as it might be something more serious such as a fracture or some issue with the bone integrity and the structure of it. And also if you have something called urinary incontinence where you can't wee or have issue going to the toilet following back trauma, then please go. These are some of the red flags that if you experience them, then please go, as I've been stressing, please go to the GP. However, if you are not, then here are a few pointers in terms of directing your treatment and your active recovery. Do about 150 minutes of exercise per week, whether that's running, skipping, going to the gym, just something to keep your body active and to get out of that sedentary lifestyle if you live one. In addition to that, keep your posture correct when you're sitting down, whether that's the use of a laptop stand where you have to constantly look up rather than looking down when using a laptop, and sitting correctly in the chair with your shoulders rolled back and your chest out. These help attenuate the causes of lower back pain and the feeling of it. Also, losing weight, keeping your diet healthy and reducing the intake of junk foods such as crisps, deep fried food. These all make you healthier and will reduce your lower back pain in the long term. Apart from that, that was kind of a whistle-top tour of mild lower back pain. Please comment down below any questions you may have. Apart from that, please subscribe to my channel. We've got about 76, 77 subscribers. So that's really good. I'm really happy with the progress. And I'll try and keep the videos coming. I've had a few exams recently, so I've had to prioritize them over making videos. However, my exams are finished now and I'm going to try and keep producing videos at a more regular rate. In terms of the future videos, as I said previously, this is one part of a bigger series. So the intermediate and serious causes of lower back pain will come in the future. In addition to that, I have a video coming out for the gym goers, whether you're new or regular. I'm going to cover something called DOMS, which is the feeling of having severe muscle fatigue following an intense heavy workout. So I'm going to look into the science of that and also present different research cases. Apart from that, make sure to subscribe to the channel, drop a like on the video and comment down below what other conditions you might want me to cover in the future.
I was melanin, coarse hair, coarse my skin, soy sauce, I'm boisterous. I bun with your babes and feed the oysters. Oysters man think that they're hot, like raw mustard. More time is sweeter than sponge cakes and birds custard. Fix your posture. I must have been 16, another cube buster. In co-op there had taught me about the custer. Wasting time instead of grinding harder than you can, you muster. Bye bye the rules of stacking notes and making bands of sorts of. I think there's some